Okay.
What we're trying to do with our affiliate program is try to give our infusionists or IV therapists in our office a different professional compartment to work with. Right now we are seeing a great deal of interest in accreditation. So most of the IVs now are being done by nurses. Nurse Association are actually trying to get a monopoly on it. But most of our offices, we have people working for us 15, 20 years, not nurses, some of them LPNs, some are MAs, and they have experience. And what we do in the chelation industry, nutrition industry, is very different from what they do in the hospitals. Most of the nurse infusionists are trained for IV therapies in hospital, which means antibiotic therapy, taking care of critically ill patients. Whereas a lot of the patients are not critically ill, they're just ill. They're the walking ill. So to train them and give them a standard of care and give them a professional attitude, give them an ethical system. So basically what we're trying to do is take all our infusionists and give them training so they can actually have a title of infusionist, which means they would be trained with all the basic training the nurses who do infusion therapy would get. And then on top of that, they're going to be specialized in whatever they do in their offices. And we would like to give them a certification, which means they would have worked with us for a couple of years, met all the requirements, the national requirements, which will be the standard of care for infusionists. So they don't have to be nurses, but we're basically taking much of the protocols and the value system the nurses use in IV therapy and designing it for our infusionists. And they will take courses here. They'll probably have 16 hours of didactic training, 16 hours of clinical training, how to start an IV, what to do with IV, meet all the CDC requirements, the OSHA requirements. They're going to handbooks, they're going to policies, procedures, and over a span of 3 years, they're going to pyramid from the basic courses to, for example, next September I think we're having an IV nutritional course, or nutritional course just for the infusionists and the RNs. So they are going to be just like the physicians have a track of going to board certification and excelling in the profession. Here is IV technicians or infusionists who are going to get education, grow in the education, grow professionally, and some of them may even teach, some of them may even write articles. We are actually creating a profession for them so they can be proud of it. And these are the patients, these are the people who make us doctors look good. They're the ones who do the infusion. And so our patients get the best care, not just because the doctor is good, but the infusion has to be good, especially in chelation. So our training involves not just IV therapy, it's OSHA therapy, it's how to treat patients, how to triage patients, how to give value-added service to our patients, how to educate themselves so they actually know not just how to start an IV, but anatomy, physiology of the IV, how to mix the medications, how to actually perform the task within a standard of care and excel the standard of care, and build a community of them through internet so they can share information, share knowledge, and as new rules come out from the state or from the federal government, they can rise up to the occasion. At least they'll have a chance, and that's what the American dream is about, to achieve the best and be the best you can be. And here's a chance for them to form a system so they can be best they can be, and they can give the patients the best care, make the physicians look good, and professionally be satisfied.
Mm-hmm.